Good afternoon, everyone. My name is Ravi, and I'm from DRFHE team. And welcome everyone for Awareness for Life, a webinar series for your wellness. This webinar is brought to you by Dr. Reddy's Foundation for Health Education. Dr. Reddy's Foundation for Health Education has been in forefront of organizing soft and behavioral skills training programs for various healthcare professionals for more than a decade. Customized training programs are held across the country to bring out transformation in the patient care. DRFHE also conduct health awareness sessions for employees of various corporates. Dr. Reddy's Foundations for Health Education has impacted than 250,000 healthcare professionals till date, which include 26,000 senior consultants, 138,000 nurses, 33,000 physicians assistants, 17,000 pharmacists, and 13,000 postgraduate doctors. DRFHE also engaged 230,000 corporate employees through Awareness for Life session. And today with us we have Dr. Savitha Deshpande. Can we move to the next slide? Yeah, Dr. Savitha has over 20 years of experience in patient care. She is expert in infection control and disaster management. She is empaneled in KIOS, NQAS, and NABH assessor for Quality Council of India. She is also trained internal auditor for JCI. Dr. Savitha is presently working as the head of quality and RL Jalapa at RL Jalapa Hospital, Sri Devaraja URS Medical College, Kolar, Karnataka. Dr. Savitha, we welcome you abroad, and I'll hand over the mic to you. Thank you.
Thanks, Ravi. Thank you so much. My sincere gratitude to Dr. Reddy's Laboratories for giving me this opportunity to come over and speak to a wide audience. We always generally speak to the doctors or the medical fraternity, but it's a different experience when you're talking to people who are so much interested in medicine and to know more about infections. So it's nice, a very wonderful opportunity. I would start off my talk this way. So by the end of the session, I'm sure all of you would go home with this message on the nature of the most common respiratory infections. Now, we are all in this era of these respiratory viral infections. So I'll tell you a bit about these common infections and how they actually enter and manifest in human beings. You will also know how to protect yourselves in this time, in this testing times when these viruses are trying to conquer us. So I will also speak on how we can develop the home care. Now, a lot of us have a lot of questions on how we could do home care. You know, it's always not that we could go to hospitals at every time. So we should know some small things which we could incorporate at the home level, and our daily life and how we cope up with stress when it comes to the infections. I will also speak about how we need to care our children and elderly, the two extremes of age groups which is more vulnerable for viral infections or these respiratory infections. And of course, to overcome the anxiety, fear, and anger which is always associated with infections. You're always worried when this is going to end and when this is going to finish. So this has to be handled well. And of course, a lot of myth busters I'll be talking to you about, because there's so many myths running around everywhere. So we are totally confused about what is right and what's wrong. So this will be the gist of my talk for today. So getting into the topic, I'll first introduce you to our respiratory system. Most of us have seen these in the textbooks. We've understood the respiratory tract is divided into the upper respiratory tract, which is mainly the nose, the nasal cavity, and behind it you can see the pharynx and the larynx. And below this is the lower respiratory tract. The most sensitive part, sterile part, is the trachea, which extends from the larynx, comes down and forms the bronchi, and this bronchi will be divided into different bronchioles, and these bronchioles end up into alveoli. I'm sure most of us know this as a school lessons. So this is another picture I'm showing you. You can see the trachea, which is again branched into bronchi and bronchioles, and this branches end with these alveoli. These small alveoli are the ones which receive the oxygen, they receive the air, and whatever enters through the air get into these alveoli, and then they are purified and then sent back from the nostrils to outside. So with this, just you all know that if in case we have infections of the upper or lower respiratory tract, can be because of bacteria, it can be because of viruses, can be because of fungi or parasites. There are multiple microorganisms which could cause pneumonia in the lungs. That is, when the infection goes to a stage when the normal alveoli, which are sponge-like, which can take the oxygen and leave the carbon dioxide out. If it's filled with mucus, that is, the mucus is nothing but our body's defense system, the defense mechanism which releases all these WBCs, and all the defense cells come out in the form of mucus, and when they fill the alveoli, we have this condition called pneumonia. So this is what happens when we usually have infections. So when this mucus is filled within the lungs, this is thrown out from the lungs as sneeze or cough. So this single sneeze, as you know, which is a very common thing which we see, the common viral infections which we see day in, day out as a common cold, which we experience this sneeze so many times, we do not know that each sneeze can produce up to 10,000 droplets. And these small droplets contain the virus or the bacteria or whatever infectious agent which we are carrying within our lungs. So what we should know about a sneeze or a cough is, once this comes out of the body, this forms droplets carrying these organisms, not only falls out of the body into the environment, it also settles onto the material whichever is there in our environment, like cardboard boxes or stainless steel or plastics, and it settles on it. So this is a good picture for you to see. Now when you have a sneeze or a cough with release of these droplets, what happens is these droplets contain these infectious agents, fall into the environment. Now the throw of this sneeze or this droplets is, it could vary, the bigger droplets, they fall very close to the person, maybe about 3 feet. This could be any infection. It could be Ebola, it could be measles, it could be any respiratory infection. This is the way it manifests. So the droplets which are heavy fall almost closer, about 3 feet from the person. But whereas the very tiny droplets which are almost invisible to our eyes, which we don't even know, go far away to more than about 6 feet, and they fall down. So whatever material is lying in this 6 feet distance may have these droplets fallen down on them, and it may have the organism within the droplets. So we should all know that when somebody sneezes or coughs, the whole environment is filled with these droplets and microorganisms. What we generally have to see is the most common symptoms with these patients who harbor these viruses or bacteria or these organisms is they present generally with fever, cough, and sometimes when this, it leads to a stage nearing pneumonia, they may even present with shortness of breath. The symptoms may appear generally depends on the incubation period of the agent, whichever has infected us. It could be from 2 to 14 days, lesser or more also. So how does the spread of infections take place is very, very important for us to know, instead of, just getting scared of these infections and, panicking and getting into anxiety and all that. Let us see how these infections spread. Now, the first way in which these infections could spread could be person to person. So that is usually through coughs, sneeze, or talks. When the saliva or the secretions from the nose just falls on to the other person or other material, this person to person spread happens. So these droplets will land into the nose or mouth of the people. So when you are standing across them or somewhere near the person who sneezes or coughs, this droplets, if it enters onto the mucous membranes, the mucous membranes usually are on the nose, on your face, your mouth, or your eyes. These are the three vulnerable areas from which this, the organism can enter into your body. This will be inhaled into the lungs. Now, if your body gives the right temperature to the agent, and if it surpasses your defense mechanism, if it surpasses your WBCs, your defense cells, if it's lucky enough to enter into your body, it could be inhaled into your lungs. So the funda is when you maintain a good social distance. So social distancing is, so what I was saying is the farthest the droplet can reach, that is about 6 feet. It is very important for us in preventing the spread of any infections. It could be any bacterial, viral, or whichever you're talking about these days. Any of these infections could be avoided if you maintain a social distancing of about 6 feet. So if one mode of spread is person to person, the another mode of spread of these infections is through fomites. Fomites are nothing but your handkerchiefs, your tables, chairs, or any of these objects where the droplets have gone and settled with the virus or the agent. Now, when you touch the surface or object that has the virus on it, and then you take this onto your mouth or nose or eyes, that is when this agent will get transmitted to you. Otherwise, the chances of the spread of this organism to you is very, very less. So you must know these two main modes of transfer. One is as the person coughs, it may go and settle onto your mucous membranes, or it may settle onto some objects which you touch and take it to your mouth or nose or eye. You should also remember that there'll be many people even without a cough or a sneeze, but they may be spreading the virus in the community. This is one thing which should be there behind our head, and we should always remember that not all people who cough and sneeze are dangerous. So it is not right on our part to put people who have a cough or a sneeze on a bad platform and encourage people who don't have, and you think you are very safe with them. No, that may not be right all the time. Now, how do you protect yourself and how do you take everyday precautions? Now, we all must understand that we do not know who are the people who are carrying these viruses or bacteria or these organisms. It is always better we take everybody as potentially infectious people instead of blaming somebody or naming somebody as infectious and keeping them away. Let's be careful with whatever activities we do by considering everybody as potentially infectious. So this keeps us in a very healthy relationship with everybody whom we are dealing with at home or at work. The best way to prevent illness is to avoid being exposed to infection. So how do you avoid being exposed to infection is cover yourself with a mask. You can always cover yourself so that the person's secretions don't come in contact with either of your mucous membranes, and especially nose and mouth are the area which carries these viruses or bacteria inside. So you can avoid being exposed by wearing a mask, or wearing just a mask and forgetting about hand wash. Again, you are at a big risk. So there should be simultaneous use of the mask, and also a frequent hand hygiene has to be maintained by all of us, so that even by chance get hold of this agents onto our hands, because hands are the most vulnerable areas of our body which carries these viruses, and it can easily enter into the nose because the hands keep touching the face. So how do we maintain or how do we take precautions? So practice frequent hand hygiene. So this is the mantra for all of us. Instead of panicking and running away and saying that he is positive or she is negative, instead of all this, practice frequent hand hygiene. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose or either a cough or a sneeze. Now, one thing I would like to stress upon is there is nothing like soap and water. You must remember that most of the agents, especially viruses, which cause these respiratory infections or any infections, like it could even be HIV, hepatitis B, hepatitis C, the coronaviruses, any of these viruses, you see they are all enveloped viruses. So once a virus has an envelope on itself, soap is the best agent to destroy it. The moment you use the soap and water, it immediately attaches onto this envelope and destroys the virus, especially the viruses. So if you're scared of viruses, don't worry. Always, frequently wash your hands with soap and water. It is better than even your expensive hand sanitizers. So soap and water is always a cheaper option. And of course, when you are using soap, I would say prefer a liquid soap. Liquid soap because it's usually in a bottle and you are using a plunger. So you're not touching the soap as such. So when you're using a plunger, a small amount, maybe some 2 to 3 ml comes onto your hand and only that is brushed onto your palms and a lather is formed and your soap acts on every area of your hand. So soap and water is the best choice. You use sanitizers at places where you don't have a sink, where you don't have a soap, or if you wash your hands, you don't have a towel or a tissue. At those areas, you will have to take off your hand sanitizers, which are usually alcohol based. And this alcohol based sanitizers preferably should be about 60% to 70% of alcohol should be present. It's not that you just buy some hand rub and think you're using a hand sanitizer. Now, I will play this video of hand washing. We'll just get back after we see this. Very good video by the director.
There are several practical measures you can take to protect yourself from the new coronavirus. One of the most important is regular, safe and effective hand hygiene, using soap and water or alcohol-based hand rub. Here are the steps recommended by WHO to follow. Safe and clean hands anywhere. Now I'm calling on the world to take the WHO Safe Hands Challenge to be ready for coronavirus.
So what we saw in this video is how we have to meticulously wash our hands. Now, washing hands as I told you, the best way is using a soap and water, or you want to use a hand sanitizer. Now, the steps have to be in the sequence which we showed you, or you can always download this from the WHO World Health Organization's website, where all the steps are in the form of diagrammatical steps have been displayed. So you can always look into steps. So what is very important for you to understand is your palms. When you just look at your palm and the back of your hands, what you see mainly are the creases. The creases are the places where the viruses or the microorganisms hide. So when you think that you washed your hands and not concentrated on the creases, there's all possibility of these microorganisms surviving on these creases. So whenever you wash your hands, concentrate on these creases. It could be on the palm. So every time you do a step of hand washing, either it's on the palm or back of the hands, or interlacing of fingers, or washing your thumb or your nail beds, you should always perform it 5 times per step. So every time it's 5 times, you're concentrating and rubbing on those areas by a meticulous method. So this will remove the microorganisms from your hands. There could be many times when you're not concentrating on your hand wash, the organisms may still remain on your hands, and you may carry this home to your children or elderly people at home. So you must know how to wash your hands, and it must be complete. So when it is a hand sanitizer you've chosen, you should see to it that it has at least 60% of alcohol as a content in your hand sanitizer. And you always see to it that you avoid touching your eyes, nose, or mouth with unwashed hands. So this is one thing you can always keep it in your mind. Routine cleaning of frequently touched surfaces. Now, there are many areas at home or at workplaces which we constantly, multiple people touch. For example, it could be the switches of your electric switchboards. It could be your door handles. It could be many areas which multiple people touch them on a regular basis. So you will have to identify those areas, and routinely, you will have to clean them frequently. This is one way in which you can get away with infections. Avoid close contact with people who are sick. Now, it doesn't mean that you keep the sick away, but you should know that if the closer you are to the contacts who are sick, you could always acquire these infections, especially the children. Or if you have an infection, please be a little away from the elderly at home. So this is how you stay away from infections. And that is why the slogan which is going on nowadays is stay home, stay safe. So the more you are isolating yourself from the sick and the infectious, you are safe. Put a distance between yourself and other people. Generally 6 feet is recommended. And you have to cover your face with a cloth face cover. Now, I am stressing on a cloth face cover to protect other people in case you are infected. Now, this is called as a mask. This is commonly called as a mask, which people we see are wearing, and they think that they are wearing a mask and they are safe. Now, mask should be on only when you are infected and you are scared if your infection spreads to the others. Otherwise, there is no point in wearing a mask. You can wear a cloth mask and protect yourself in case you think that you could acquire an infection. Cloth mask is enough for people who are at home or who are traveling to work. Please do not use the surgical masks or the N95 masks, which are for the health professionals, for the healthcare professionals. This surgical mask or N95 mask are not of any benefit to the common people who are just trying to prevent the infections. So a cloth mask should be fair enough for you if you are maintaining a social distancing and also frequent hand hygiene is followed. Do not use a face mask meant for a healthcare worker. So all of us must look at this. Please don't go and give huge amounts and buy these surgical masks or N95 masks. N95 mask is a very professional mask which has to be worn in such a way, and after wearing it you will have to do a fit test. That is, we will have to test if no air entry or exit is happening from the mask. This is a very professional mask and which is to be worn by trained people. Please don't wear this mask because it could lead to complications. Wear a cloth mask as much as possible, as that would be enough for you. Continue to keep about 6 feet between yourself and others, and the cloth face cover is not a substitute for social distancing. Now, don't think that because you are wearing a cloth mask and you are distancing, you will not get an infection. You have to further wash your hands frequently because you could touch these infected droplets and take it to your mouth or nose. If you're taking care of a person who has a suspected infection, you will have to wear a mask. If you are coughing or sneezing, you have to wear a mask. If the masks are effective only when used in combination with frequent hand cleaning. Otherwise, you wear a mask and touch every possible thing which could be infected. So this won't serve the purpose. If you wear a mask, then you must know how to use it. And of course, very, very important is how you dispose of a mask is very, very important. You cannot dispose of a used mask here and there. If suppose these have these infected agents on it, this could further lead to the spread of the infection to many vulnerable people. We all must maintain cough etiquette. Now, as we know, we have a lot of disciplines in our life. We always maintain certain etiquette, whether we go to hotels or malls, or we try to maintain decency. Cough etiquette is also one of them. We should see to it that we don't cough into the air or the environment, and the cough droplets should as much as possible not spread to the others. So when you have this in your mind, when you are aware, you always can take your both your arm and forearm closer to your mouth and cough into your elbow. So this will take all the droplets into you and doesn't spread to the public. Now, the coughing and sneezing etiquette, always carry a cloth with you, a handkerchief or something that you could cover your mouth and your nose with in case you feel you have some common cold or some respiratory infection. Always cover your mouth with nose and tissue. Dispose it off properly. You know, again, you have to find a trash bin and dispose the tissue appropriately. Let it not be hanging from the trash bin, where again, this could be infectious to others. If there is no tissue, cough or sneeze into the bend of your elbow, not your hands, because again, you carry these droplets on your hands. You will again be spreading onto the other areas and people will further touch it and they get infected. After your sneeze or cough into your hand, remember, you will have to sterilize your hands by washing your hands with soap or water or cleaning with a sterilizing sanitizer. Throw the used towels in the trash. Very, very important. Throw it in a clean, disciplined way and immediately wash your hands. So this is a discipline all of us must follow in life, whatever infection you're thinking about. Now, how do you do the home care? Now, at home, what is the kind of cleaning and disinfection you do? Now, a lot of people talk about cleaning and disinfection and they think that's only in healthcare areas, in hospitals and clinics. No, you also need to clean and disinfect your areas. Whatever kind of infections you're carrying, you must see to it that your home is clean. So how do you do the home care is, you clean and disinfect the frequently touched surfaces. Now, just look at your home. Look at what are the areas which are frequently touched by many people. So clean those very frequently. It could be tables, doorknobs, light switches, could be countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. These are the areas which are commonly used multiple times by many people. So these must be cleaned very often. If surfaces are dirty, clean them. Use a detergent or soap and water prior to disinfection. Now, if you've got those expensive disinfectants from the shops or malls or whichever, now a lot of people would have told you that this is very expensive, it's a very good disinfectant. Please trust me, there's nothing like a detergent, soap or water. So first clean the areas with soap and water. You're done with most of the agents. And after that, you want to use a disinfectant, you could go ahead and use it. Now, there are a lot of things coming into home from outside. The early morning milk packets, you would get a lot of groceries that are packed from outside. You don't know what's sitting on them. You could get your courier packets from outside. You could get your newspapers. So all these could be utilized as such without panicking or without, great thinking about how to use them. Only thing is, after you utilize, remember to wash hands thoroughly with soap and water. This is all you can do. Instead of, touching them and then touching your face and infecting yourself, you could always be aware that after you touch some items which have come from outside, just go to the sink and wash your hands. Or you think you don't have a sink at that area, use a hand sanitizer. The steps of hand wash are the same for soap and water or hand sanitizers. You have a multiple environmental protection agency, or it's called EPA approved disinfectants in the market. You can get them. Some very simple age-old methods are using your household bleach. Nowadays, I don't know how many people use bleach. Some small hospitals which have constraints with spending too much of money on disinfectants, they are still using household bleach. As you all know, it's a proportion of about 5 tablespoons in a gallon of water or 4 teaspoons per quarter of water. So if you are okay with maintaining the correct dilution, and you should also know that the bleach works only for 24 hours. So if you're okay with it, you can use the household bleach and clean home. You can also use alcohol solutions. About 70% of alcohol solutions can be used to clean your surfaces, like your tabletops, your your TV, your radios, or your things at home can be used with cleaned with alcohol solutions. Or many EPA registered household disinfectants are available in the market. You can use them, and you see to it that you are again meticulously cleaning it multiple times. You should wear disposable glove when cleaning and disinfecting surfaces. Thus, you need to think, what are you cleaning? Now, if you think it's really dirty and it could have a lot of infectious droplets on it, there are chances. You can wear disposable glove and clean it. Gloves should be discarded again after each cleaning. So do not throw off the glove here and there, so that this will further spread the infection. If they are reusable gloves, these gloves should be dedicated for cleaning and disinfection of surfaces only, and you are not using these gloves for anything else. Keep it dedicated for cleaning it, and then you have to wash it and dry it in sunlight. Always remember, whether it's your mop at home or any cloth you're using to clean the surfaces, please wash it with a detergent and dry it in sunlight. Don't again wash it and keep it inside the house. Try to dry it within the house. And if the sunlight is not exposed onto it, multiple microorganisms may not have got destroyed. They are still there. The organisms like pseudomonas and plenty fungi will be still there in the wet mop or wet cloth. And you will again take that the next day and go on mopping into the same areas at home. You have carpeted floor, rugs and drapes. So you will have to remove the visible contamination on it, if at all, if it's present. Clean with appropriate cleaners, which is indicated for use on these surfaces. So whenever you find dusty items, please do clean it very often. And after clean it, you will have to launder using the warmest appropriate water. Generally, you can follow the manufacturer's instructions. Always remember, when you wash something, clean something, give more importance to drying the items. Dry the items completely. If you can dry the items in sunlight, nothing like it. Electronic items. We all use our cell phones, tablets, touch screens, remote controls, keyboards, and whatever we generally use it like day in and day out, but we don't think about cleaning it. So now that we understand that there could be these infectious droplets sitting on it, and we need to clean it multiple times and be aware about it. Consider use of wipeable covers for electronics. Consider the use of alcohol-based wipes or sprays containing at least 70% alcohol to disinfect touch screens. Dry the surfaces thoroughly to avoid pooling of liquids, which will further attract the microorganisms in the environment. Wear disposable gloves when handling dirty laundry from an ill person and then discard after use. So when you have a sick person at home, use disposable glove to remove the person's items and see to it that you don't contact infection. And after you take off the dirty laundry from a sick person, remember you will have to clean your hands immediately after the gloves are removed. If possible, do not shake the dirty laundry to minimize the possibility of dispersing virus through the air. So this dirty laundry which you are carrying from the bedroom to the bathroom or the area where you're going to clean it, don't shake it, because as you shake it, these viruses or organisms could get into the atmosphere. Clean and disinfect the clothes, hampers, and consider placing a bag liner that is disposable. Now, many of us have these hamper bags where we collect all the dirty linen and we again take that out and we take the linen to wash, but we forget to clean the hamper bags. The hamper bags can be cleaned if it's made of a cloth, or you can have some covers placed inside the hamper bag so that the next day you're carrying the dirty linen to wash, you can take it with the cover and your hamper bag is clean. So you will have to look into all these small things to keep yourself safe. Hand hygiene is very, very important, and also remember you need to avoid touching your eyes, nose or mouth with unwashed hands. And the clean hands are the ones you have to clean after blowing one's nose, coughing or sneezing, after using a restroom, before eating or preparing food, after contact with animals or pets, before and after providing routine care for another person who needs assistance. Generally, they are the people with extremes of age, either the tiny children or the elderly. So whatever, you have to clean your hands after most of these activities so that you are carrying clean hands. You need to know certain emergency warning signs at home so that you could seek medical attention at the earliest. So other than the common cold and cough, which goes on every day, and you think that it will take 3 days, 4 days, and it will, come down. At the same time, you must also keep noticing if the person has some troubled breathing, if the breathing, is slowly getting troubled, and if there is persistent pain or pressure in the chest. There is a new confusion, person is a little bit drowsy and he's, talking irrelevantly, think about it. If the bluish lips or a face are a little bit evident, think about it take it as a warning sign and go to your nearby hospital. And if someone in your home is sick, if at home somebody is sick, keep the ill person in a separate room from others in the household if possible. And the person is kept isolated. Also remember the items surrounding him has to be disinfected often. Don't leave it and don't leave the sick person in that room and forget about him. Avoid sharing personal items. If you become sick, if suppose you become sick, isolate yourself and always keep yourself connected on phone or email with others. In case you have certain warning signs, you can always let them know. Stay informed about the local outbreak situation. Now, please, it is the nature's law that once in a while there is an outbreak in the community, and this we have seen on and off occurs by the nature. So we need to be informed about it. So whatever is the call of the nature, we'll have to be aware about the situation and take appropriate precautions. Notify your work if your schedule needs to be changed. You can tell them that you are not well and you may need to work from home. Take care of your emotional health of your household members, including yourself. So the daily life and coping with stress. This, you have multiple topics in the webinars coming up, and a lot of people will be talking to you about how you deal with stress. Definitely, just to add a few salient points on when you are or a family member is going through stress of this infection. Remember, take breaks from watching, reading, or listening to news stories, or especially the social media. Take care of your body. Take deep breaths, stretch, meditate. Eat healthy, well-balanced meals, exercise regularly, get plenty of sleep, avoid alcohol and drugs, make some time to unwind, try to do some other activities you enjoy, connect with others, talk with people you trust about your concerns, talk about your feelings. So this is the way you handle or tackle the infection. So there are a lot of people, there'll be a lot of people trying to tell you a lot of things which could be myths many times. So is it a myth or a fact? You will have to find out. You have to read about it, find out. I have some 3-4 myths which I've been hearing. One is eating chicken spreads viral infections. This is absolutely wrong, because eating doesn't spread viral infections that lead to respiratory tract infections. So this is wrong. Infections cannot be transmitted in hot or cold climates. So many people say that if we are in a hot climate, we don't have to worry about any virus or any infection. We are safe. Please don't think that way. There is, COVID infections in Dubai. There is also COVID infection in United Kingdom. So the extremes of temperatures are very much okay for these agents. So it is important for you to maintain 2 things. One is social distancing, and the second is frequent hand hygiene. Remember, these are the only 2 ways in which we can avoid infections. The third myth is hot water bath prevents us from infections. This is not right again. Viruses are transmitted through mosquitoes, not with the respiratory tract infections. Please don't believe it. And hand dryers or ultrasonic disinfection lamps kill viruses. This is also not right. In fact, these disperse the droplets or the agents which are sitting, and it could lead to the transmission of infection even more than what we think. So these are the few facts and myths which I wanted to share with you. And now I would like to give you some time and ask me questions in case you have any.
Savitha,
Yes, Ravi.
so there is a first question from Kavita Jain.
Yeah.
Something like, my son was quarantined for 14 days after returning from London.
Okay.
Now, how many days more required to be in quarantine, although he is doing well in health-wise?
Yeah. Kavita, probably now you're talking about the COVID-19 quarantining, what's happening for people who are coming from abroad, or endemic, possible endemic countries. Now you must remember that the incubation period for this virus is about 2 to 14 days. So if suppose he had manifested the infection, he would have thrown out certain symptoms like cold or cough, or that if at all it would go into certain complications, there would be some pneumonia or all that. Now if suppose he didn't manifest with any of these symptoms or signs, I think there's nothing for you to worry, and he can be just normal like before, and just let him enjoy.
Okay. We have second question from Lokendra Jha. Okay. There have been reports coming that virus could be airborne. Is it true? If it is
Lokendra,
airborne,
this is a very controversial thing now, because we as doctors or we as healthcare professionals, if we start thinking about airborne nature of this infection, we won't be able to survive in hospitals. Now, there are not many studies with COVID-19 because it's a 2019 strain, as we all know. We don't have too many studies on it, but of late, very recently, some two very good journals have published data on the droplets being, submerged in the air, and that it could transmit these viruses by just being in the air. But I personally would say that until more reports come, let's not break our heads on it. For now, they are droplets which are there on the surfaces. For Indian conditions, Indian people, let us, wash our hands, maintain a good hand hygiene, and wear the mask and maintain the social distancing. This is more important than thinking about the airborne, virus. And no, let the things take its course. But for now, it's not.
Okay. There was a question again. So this is regarding when we cough, there'll be droplets. Bend elbow will be exposed to cough droplets. Then what to do?
See, the cough etiquette is told to us so that we are aware about not transmitting our viral infections to the others. Now, it doesn't mean that you cough into your elbow and just walk away and you just normal. No. So after you cough into your elbow, remember that all the droplets are there on your shirt or on your, body. Now that you must be aware, and if possible, change your clothes or have a shower. So this is all to tell you that you don't transmit to others, but then when it is on your body, take care and see to it that you change your clothes and keep yourself sterile.
Okay. There is a question from Abhishek.
Yes.
He's asking, how can we clean vegetables, fruits? Can we purchase which we purchase from fresh markets or from local vendors?
Abhishek, wash your vegetables with a pinch of salt. Okay. Washing them and keeping them aside in a salted water should destroy almost any agent which is there on the surface of these vegetables. Keep it for some time and then use it accordingly. You are going to boil them and have them. So I think it shouldn't be a problem. And don't be so very worried about what will happen to each and everything. But washing it with a running water or age-old solution, washing it with running water for some time and using a pinch of salt and keeping it for some time, I'm sure most of the microorganisms get destroyed.
Yeah, thank you. And we have question from Sukhwinder Singh.
Yeah.
How many times we can use a single mask, or should we dispose after once?
I would recommend a cloth mask. As I've been telling in my talk also, I wouldn't recommend you people to buy a surgical mask, spend so much of money, and then you start thinking, how do we use these masks? Please buy these cloth masks. You can have some 10 masks with you when we are spending so much of money on the others. Why not buy some masks? Use it one day. That night, please put it for wash. Next day, let it go into the sunlight. Let it get dried. Use another mask. And then once it's dried in the sunlight, use it the other day. So please don't worry that much about using a surgical mask or an N95 and all that. So cloth masks are fair enough. And maintain the social distancing. Wash your hands frequently. These three things should help you combat all these, issues.
Okay. Can we use AC and cooler from Akhilesh Singh? Yeah.
ACs, coolers, they generally circulate the air in within a certain area. These are not recommended as such. You'll have to clean your air conditioners and coolers over, regular time. That's why we have these AMCs and we have people coming and servicing them. But during such outbreaks, when we have certain viruses, if you think that you are in a place where you have a lot of viral infections, it's better to switch off the ACs and open the windows and take the fresh air from outside.
Okay. Okay. There are questions keep coming up, and there is one question as such, which says, uh, Madam, if we have a chest pain for 3 to 4 days, then what are the precautionary measures has to be taken?
Chest pain, it's not that because I said chest pain or pressure in the chest could lead to be, it's a warning sign. But then it could be of many varieties. Now you must know what is it leading to. Is it a cough, cold, and the chest pain after, extreme, when you are coughing, multiple times, your ribs and your muscles are getting exhausted. Is it because of that? Or is it because of some other etiology? Now you'll have to look into it. Chest pain is something you will have to go to a doctor.
Okay, Sunita. Oh, sorry, Savitha. Okay, that's a kind of a confusion here. Okay, any advisory with regards to non-veg food items?
Nothing, absolutely nothing. Please have your food and enjoy your food.
Okay. Yeah, there is a question again. Instead of mask, can we use handkerchief?
Yes, you can use. See, the main basic idea of having a mask is you don't, as I told you, people, all of us need not wear masks. I being a doctor, I work in the hospital. Let me tell you, I've not worn a mask because my area of activity is just, to places where I generally don't go every day to see patients. I don't feel the importance of wearing a mask. So who will wear mask is a person who already has cold or cough. He doesn't want to transmit to others, will wear a mask. Or if you are with a person, your colleague or your family member has an infection, now you are scared you will acquire the infection, wear a mask. So you must know, let's look into the situation. If you think a mask is required, you wear it. Otherwise, it's not required. You maintain a social distancing of 6 meters and 6 feet, and then you wash your hands frequently. I think that should be okay. And until you have cough or you have somebody having cough or sneezing, mask think over. I mean, at least please don't buy those expensive masks and waste your money on it. You make some masks at home, stitch it, and use the cloth masks.
Yeah, probably this is the last question.
Yes.
My question is that this is from, there's no name here. How many days a virus lives in our currency?
Notes, is it?
Yeah.
Currency notes. See, when you look at the various areas, there are many studies which have been coming up. Again, let me tell you, this is a 2019 strain, whichever you're talking about the COVID-19. If you're talking about currency notes and COVID-19, let me tell you that different areas it survives for different time. Now they say that on copper it only survives for 4 hours. Where it comes to the tabletops or surfaces, it can survive up to 3 days. Some areas they have seen that it survived up to a week. So this, how many days it survives is not important to us. Okay, it's just a matter of curiosity. We want to know, we can know about it. But always remember, we don't know where a virus is sitting or where it's growing. So always maintain the frequent hand hygiene wherever it is, how many ever days it's going to stay. It's not going to help us anyway. We'll have to wash our hands frequently, and we should not take the untidy hands or unwashed hands onto the face so that the virus doesn't get transmitted. So this is what I feel. All these studies are just out of curiosity, but this shouldn't be, making any kind of impact in our discipline.
Yeah, kind of a myth again.
Yeah, very much.
Yeah. So, thank you so much, Savitha, for taking
Thank
us
you.
through the nature of common respiratory infections,
Yes.
protecting ourselves, the home care, and the daily life. How do we cope up with stress, and again, taking care of children and elderly, and how to
Yes.
overcome the anxiety and all. And the
Yes.
basically the myth busters.
Yes.
We had so many questions on that, and you cleared the air. And thanks, and thank you once again.